Hello, my name is Ibet Nieto Vargas. I am a nursing student at Northwestern Oklahoma State University. I am studying so that I can be an ICU nurse. Northwestern has many different majors besides nursing, like accounting, so if it's something that you'd be interested, this school is amazing at that. There's also many sports like soccer, football, and baseball, just to name a few. Today I will be talking to you about dental health along with Jake. So, what is dental health? It is the practice of keeping the mouth, teeth, and gums clean and healthy in order to prevent diseases like cavities, gingivitis, periodontal disease, and teeth sensitivity.
What are cavities or tooth decay? Well, cavities and tooth decay are little holes that are inside of your teeth that are caused by the growth of bacterial plaque. And this plaque is a buildup of the food particles that are left behind after you chew. And bacteria very much like to eat these. And so they will eat these plaques and then they will release acidic chemicals that will dissolve the enamel of your teeth and create tiny holes in them. And the more plaque that gets stuck inside of these holes, the more bacteria accumulate and the larger the holes get. So it is imperative to take care of cavities as quick as possible.
So, for gingivitis, it is the inflammation and tenderness of the gums. The causes are due to short-term effects of plaque deposits on the teeth. As you can see in the pictures, there's a lot of reddened areas around the teeth. So the plaque is a sticky material made of bacteria, mucus, and food debris that builds up on exposed parts of teeth and a major cause of tooth decay.
Periodontal disease is a gum disease and infection of the tissues that hold the teeth in place due to poor hygiene. This can cause painful chewing, even malformations of the teeth, and eventually tooth loss. So, a good oral hygiene routine is necessary when combating a lot of these oral diseases. And Yvette is going to tell you just a little bit more about how to have proper oral hygiene.
Teeth sensitivity. Some people may have more sensitive teeth than others due to the enamel or outer layer of the teeth being thinner. Other cases is being the enamel being worn down from either brushing your teeth too hard or with just grinding your teeth at night or eating or drinking acidic foods or beverages regularly. Now, for proper oral hygiene, brushing. Brushing your teeth for 2 minutes twice a day is very important, but it also depends on how you're brushing. So you have to brush where the tooth and gum meets, not too hard, but not too soft either. Use the same method to brush all outside and inside of surfaces of teeth. Use short, sweeping strokes, tipping the bristles into the pits and crevices to clean the chewing surfaces of teeth, and make sure to use proper force. Too much force can break down the enamel, and we don't want that. Brush the roof of the mouth, tongue, and remove decay causing bacteria. Using a timer to time to 2 to 3 full minutes of brushing can be very helpful, or just singing a song in your head. Now, for proper flossing. Brushing won't remove the plaque and particles of food between teeth, under the gum line, or under the braces, so flossing is key to reach these areas. It is recommended to floss at least once a day, but if you can floss between or after meals, it is amazing. So how do you floss? Insert the floss between the two teeth using back and forth motion. Bring the floss to the gum line, but don't force under the gums. Curve the floss around the edge of the tooth to shape the letter C and slide up and down each side of the tooth. Repeat this process between all the teeth. Remember to floss the back sides of the back teeth. So what if you have braces? Well, that's why there's this picture below the cute little tooth, which is a water pick. But Jake will talk more about that.
Now, you might be wondering, what does nutrition have to do with good dental health? As we've seen in this previous slides on the slideshow, a lot of problems with the teeth are caused from buildup of plaque. And as we know, plaque comes from the debris that's left behind whenever you chew or eat food. So, knowing that, making some healthier eating choices, ones that don't cause such of a problem, especially to her teeth, would be a better idea. So, what are some of the causes of the nutritional causes of tooth decay and tooth problems? Well, eating sugar and starchy foods and drinking soda or juices such as orange juice or any other highly acidic juice like grapefruit juice. These are some of the major causes that cause tooth decay, especially if you're going to bed without brushing your teeth. Now, this is essential. Whenever you go to bed, that's the perfect opportune time for the bacterial to digest the plaque and to release the chemicals to start breaking down your teeth, leading to tooth decay and all of the wonderful diseases that Yvette had talked about. So when you're talking about nutrition in concerns with dental health, you want to make some realistic goals. Obviously, it would be stupid of me to ask all of you to stop eating candy. That's not going to happen. Right? Nobody's going to just say, I'm going to stop eating that candy for you, Jake. That's what I'm going to do. No, that's not happening. However, you can set a realistic goal, which would be to reduce the amount of candy you eat. Or, if you are going to eat candy, eat the candy with a meal. That way, you're tackling two birds with one stone. You're brushing your teeth right after that meal. You're getting rid of that. Plus, you get your candy. You want to make sure that you don't eat those sugary foods in between meals. And if you can't get to a toothbrush and toothpaste after your meal, make sure to get your mouth rinsed out with either just some water or some mouthwash. And lastly, but not least, another option you could do when making realistic goals in regards to nutrition and dental health is making different choices with your snacks. I know a lot of people like, your hot Cheetos and Takis, but those can be very, very, very dangerous to your teeth. You need to switch over, make the adjustment to some non-sugary stuff, maybe like just straight up cheese sticks, popcorn, raw vegetables, or even yogurt. Another concern for kids your age is preventing dental injuries. We already talked about nutrition and how that can occur in damaging the teeth, but nutrition can also help strengthen the teeth, specifically calcium and vitamin D. People often forget that the teeth are bones themselves, and the same vitamins and minerals that build up and make strong bones will make strong teeth. Now, teeth can be prone to accidents or injury, especially during sports within the teenage and middle school years. The best way to prevent dental injury is to wear a mouth guard or mouthpiece, especially if you have braces or your diet lacks calcium and vitamin D. And the importance of wearing a mouthpiece in anything athletic really not only is to protect your teeth from actually being hit by something themselves, but also to redistribute shock. Whenever you do a large body movement, such as jumping up in the air to shoot a basket and coming back down on your feet, a lot of energy gets shot up through your body in the form of shock waves. And if these go up to your teeth, it can cause you to bite down very hard on your teeth, and the teeth can shatter or crack. But if you're wearing a mouthpiece, the shock is able to be absorbed by that mouthpiece instead of by the bite of your teeth, thus saving you all of those pearly white chompers. Now, let's really break down the mouth guards by the requirements and some of the components that make mouth guards and look at which ones would be the best for you. So, mouth guards approved by the American Dental Association require that they be made of resilient material approved by the US FDA and cover all remaining teeth on one arch. They must stay in place comfortably and securely. They must be physiologically compatible with the wearer, which means they must be able to go into your mouth and fit. They must be relatively easy to clean, and they must have high impact energy absorption and reduce transmitted forces upon impact. Those are the things that I was talking about earlier, the shock that happens whenever your body is doing large full body movements. So that's what the ADA is looking for whenever you are selecting a mouthpiece. Now, there are several types of mouthpieces that you can use. The most common is called the mouth-formed mouthpiece, which is where you will place a mouthpiece made of a rubber or silicone material inside of boiling water and then bite down as the mouthpiece conforms to your bite. This is one of the most effective for contact sports such as football, wrestling, shot put, and any throwing type sport within track and field. Custom-made mouthpieces are the greatest line of defense from dental injury, but they are, however, the most expensive. Custom-made mouthpieces are mouthpieces that a dentist or other dental health professional will make a mold of your mouth, and then they will create a mouthpiece, whether out of silicone or rubber, depending on the material they wish to use, and then that mouthpiece will be 100% fitted just for you. It will protect you to the best of its ability, better than a boil and bite, because it was created by the professional specifically for you. All right. Now it's time to talk about something that's near and dear to my heart. Braces and special dental care. When I was in middle school, I too had braces. And I understand that braces are a common thing within the middle school setting. So the first thing we're going to do is look at braces and what they're for. Then upon the next slide, we're going to look at different types of braces. And then we will also address how braces affect self-esteem. So braces can help to straighten or correct teeth deformities. There are several varieties of braces, including the Invisalign, ceramic braces, self-ligating or Damon braces, and there are various others. Now, braces, specifically within the middle school years, can increase the risk of negative self-image with teens. So a few steps to be taken to avoid that negative self-image is that proper dental hygiene can act as a preventative measure for even getting braces. If you're taking care of your teeth from a very, very, very young age, making sure that your baby teeth are out when they're supposed to be, not refusing to remove them, alerting your parents to any kind of situations you have in your mouth, whether it's early teeth showing up, late removals, making sure that you are talking about that with your parents before to make sure that you're tackling any problems that may be helped by braces in the future. If you address them now, they won't become a problem later. The usual dental hygiene that a regular middle schooler or teenager would do has to be adapted specifically for braces. There are also a lot of restrictions on what you can and cannot eat. Thus, it's narrowing down on a lot of the social aspect for you guys. You can't go out and get candy or milkshakes with your friends, so it can be a hard time. It was for me. Teens should be referred to a mental health provider after braces are applied, or even as soon as they know that braces are going to be a problem or braces are going to be applied. Now, you may think that it's not necessary. That sounds silly to go see a mental health provider, but your image and your self-image are being adapted. They're being created while you're in middle school. So it's imperative that you don't let something as silly as a dental tool detract from who you are as a person. That being said, let's look at different types of braces. So if you do run into the situation of getting braces, you can understand your options and talk with your parents. Which ones would be the best to reduce your feelings of negativity about yourself? So that being said, let us move on. So here there are a few different types of braces. You have the Damon braces, which attach to themselves and they lay flatter on the teeth. You have your traditional braces, the linguinal braces, which go behind the teeth, metal braces, again, your traditional ceramic braces, which look like they don't exist, Invisalign braces, which are trays of plastic that bring your teeth closer and closer together. So knowing all this information, it might be helpful if you figure out that you're supposed to get braces to make a better decision which one works best for you. So I wanted to just take some time and look at braces-specific hygiene. And it's recommended to brush 5 times a day for 5 minutes at least. And you should be able to do this if you are brushing in between your meals and then brushing when you wake up and brushing at night. 3 meals a day, in the morning and at night, that's 5. Okay, so in order to prevent the braces from breaking or coming loose, as I talked about earlier, there's going to be a lot of food restrictions that you may have. You should not eat corn on the cob, caramels, or anything sticky like that. If you eat a bagel, cut them into pieces. Do not chew on ice Okay? I know that from personal experience, your braces will break. Taffy, again, chewy stuff. Whole raw carrots, harder things. If you're going to have carrots, boil them or cut them into tiny strips so they are thinner to bite into. Peanut brittle, again, harder candies, harder foods. Whole apples, again, some of the harder things to eat. Popcorn, just the pieces could get lodged inside of the brackets. And then gum of any kind can stick to the brackets. The flossing frequency should remain the same, however the flossing technique has changed. The orthodontist should give you a small, thin little device that looks almost like a needle that you will attach the floss to and thread it through your wire and bracket. Then you will use the same technique of creating the C shape to remove the plaque, as Yvette talked about in the previous flossing technique. Brushing technique is not changed very much. There's a little graphic here that I'll pause and let you guys look at while I talk about non-bracket braces. The non-bracket braces have the same technique that is used for regular teeth. You don't have to have a whole lot of pomp and circumstance to anything. Just your regular run-of-the-mill technique is fine, as well as a regular frequency. Hold the adhesion. However, the biggest and best way to prevent any kind of dental problem is going to the dentist regularly, usually every 6 months. If circumstances require you to get in there a little bit more, that's fine. Well, I hope you all learned something today and enjoyed this PowerPoint that Bette and I presented. And if you find yourself looking for college to go to in your later teen years, Northwestern might be the best place for you. It is for me.